Hello there, my name's Angelos and I'm having surgery here at Evelina London Children's Hospital. If you're watching this, you might be having an operation here soon too. The doctors do operations in the Children's Day Surgery Unit, which is this building with lots of brown slats on the front of it. And in the Evelina London Hospital main building, which is this light coloured building here, with the big glass atrium on top. Follow me, I'll show you around and tell you what happens on your day of operation. Can I tell you a secret? I was a bit nervous when I first came in here. I mean, like you, but I'm super brave, so I was totally fine. But it's okay to be nervous. That's what the nurses told me. To be totally honest, I went through a bit of a roller coaster of emotions. Up, down, round and round. But because everyone is so lovely, you'll be made to feel very welcome and safe here. There were even some pretty cool bits. Let me show you.
Good morning.
Good morning.
I'll be with you in just a sec.
Parents and carers get lots of useful information about your procedure in your admission letter. This will tell them important things like where to take you, what time to arrive, what to bring, oh yes, like comfortable clothes, pyjamas, a favourite toy, and definitely a teddy for me. Oh yes, my top tip. Bring a book or electronic device to pass the time. Oh yum! Okay, yes. And my even bigger top tip. Find out what time you need to stop eating and drinking before surgery. I was pretty hungry before my operation, but afterwards, when you're feeling ready, you can have something tasty. Just ask for something like a snack box.
Hello Angelos, my name is Audrey and I am one of the nurses working here.
Hello Audrey. Once you're booked in, a friendly nurse will take you to the assessment room.
Angelos, please follow me and I will show you what happens next. Please take a seat, Angelos.
Before surgery, a nurse will have to take different measurements such as how tall you are and how much you weigh. You will also get a special wristband and some magic cream. Here we go.
So Angelos, this magic cream will help your hand feel numb. So if we need to put a tube in your hand or in your arm for surgery, it won't hurt that much. Are you ready, Angelos? So, we'll also have to take different measurements such as your blood pressure. There will be a few doctors asking you some questions such as the anesthetists and the surgeons. Right, shall we go to the next cubicle and meet them?
Hello, Angelos. Angelos is waiting for his surgery in the bed bay on our Children's Day unit today. So, he won't need an overnight bag. Make sure to pack one. If you are staying with us, we will let you know if you need to stay overnight after surgery. If you are, you will get a locker to put your things in, and there'll be things like pull-down beds. So, one of your grown-ups can sleep over with you. Angelos, if you look over there, you will see the play specialist in the pink t-shirts. Hi, Angelos. You can always tell who the play team are. We're the ones in the pink or yellow t-shirts. We can help you if you feel anxious about your surgery, if you have any questions to ask, or if you just want something to do while you wait. Just ask. Oh, and remember, Angelos, I can come down to surgery with you if you want me to, so just let me know.
Hello, Angelos. Hello, you. My name is Corin, and I'm going to be your anaesthetist today. I am one of the doctors who's going to help drift you off to sleep and look after you while you're having your surgery. There are a number of ways we can do this, and I'll explain this to you on the day of your surgery. Sometimes we use a mask with some special gas. Well, I think it smells a little sweet. And sometimes we put magic cream on your hand, like we've done for Angelos. One more person from the surgical team will be coming to see you, but don't forget you can ask anyone any questions at any time. I'll see you later.
Hello, Angelos. Nice to see you again. Finally, the day you have been waiting for. We discussed the surgery at the clinic, but now it is your chance to ask me any further last questions that you might have. A lot of doctors will come to see you today, and they will make sure you know everything what will happen at any point in time. We will have to do the necessary paperwork, and then we'll use a marker pen like this one to draw an arrow at the side of the operation. Would you mind if I draw an arrow at your leg? Oh, I forgot to say, sometimes there might be a bit of a wait, so make sure you bring a book or electronic device with you. That's fantastic. Well done, Angelos. Bye.
One of the staff will walk you up to surgery, or you might get pushed in a wheelchair or a trolley, which is pretty cool.
Come on, follow us.
And your grown-ups can come along for this bit too. This is the bit I get a bit nervous at, but I know everyone is looking after me.
Hello again. It's now time to get you ready. All right, I'm going to give you some medicines to help you drift off to sleep. Don't worry about the monitoring and the beeping. It's just here to keep you safe while you're asleep during your operation. Your grown-up can give you a really big kiss now. And what we're going to do is we can all count down together. 5, 4, 3, 2, 1.
Hey Angelos, wakey wakey, your surgeon is here.
Hello, Angelos. Everything is okay. Operation went very well. You might be feeling a bit groggy now.
In a little while, we'll get your grown-ups up here. And if you feel much better, we can bring you back down to the ward.
Hello again. I was quite sleepy for a bit, but feel a lot better. Now I'm allowed to eat and drink. I'm looking forward to having one of my favorites, Evelina buttery toast. Thanks for looking after me.
Thanks for being